Video 7. Take action.
One of the most empowering things that you can do as a student at St. Mary's University is to have an understanding of what to do should an unexpected situation arise. If you've been assaulted, don't keep it a secret. Get help. Talk to a friend. Call the Sexual Assault Nurse Examiner's Response Line at Avalon Sexual Assault Center at 425-0122. Call 911 or tell your residence assistant. Go to the hospital emergency room for medical treatment and options. Sexual assault nurse examiners are available 24 hours a day to go with you. And remember, it is not your fault. You are not responsible for the actions of others, and it's not your fault that someone decided to hurt you. If someone you know is sexually assaulted or raped, and they confide in you, be a good listener. If the assault just happened, encourage your friend to call the response line first, and then go to the emergency department of the nearest hospital. First and foremost, get to a safe place, away from the perpetrator.
Believe your friend. Research shows the most important factor in recovery of someone who has been assaulted is that someone believes his or her story. Almost no one lies when reporting a sexual assault. Also remember, it is important not to engage in victim blaming when a friend turns to you for help. One very important factor in supporting the victim of a sexual assault, which has occurred within the past 72 hours, is to get them to the emergency room to meet with the SANES or the sexual assault nurse examiner. Depending upon circumstances, try to help the person understand that the following choices are theirs alone once they get to the emergency room. Whether or not to involve the Halifax Regional Police, whether or not to have a sexual assault exam kit completed and frozen for up to 6 months, or to complete the kit and turn it over to the police in order to proceed with a criminal investigation. Important factors for you to consider. Is the victim able to make an informed decision? Or are drugs, alcohol, or even lack of sleep going to contribute to the victim's inability to make the right decision? The 72-hour time frame can pass quickly, after which time a victim cannot see a SANE, toxicology screens may not show a blood alcohol level or the presence of date-rape drugs. Crucial evidence may be lost. Please help the victim make the right decision to go to the emergency room and meet with the SANES, who will then guide the victim through their choices.
Respond to any physical or personal needs and offer to help your friend to contact the Sexual Assault Nurse Examiner's Response Line and to go to the hospital. You can get medical care without reporting it. A medical examination can detect and prevent injuries, STIs, and pregnancy. It can also detect the use of date rape drugs.
Listen to and comfort your friend. Don't try to take control of the situation by saying things like, "Here's what you need to do." And remember, they may not want a hug or physical contact. Be patient and just listen.
Reinforce that they are not to blame and remind them that they did not ask for this to happen to them.
Don't react with violence. You may want to go out and confront the rapist yourself, but remember, this isn't about you and your anger. This is about your friend.
Recommend that your friend see someone who can offer emotional support, like the counselors at Student Services. Offer to go with them, but if they refuse, that's their choice.
So remember, to get help, call Student Services. To report a crime, call 911. All university employees are required to report information about sexual violence to Student Services. Reporting these crimes is important. It's the best way for the university to ensure your safety so that you can get the most out of your education.
Remember, you're not alone. You're an important part of the St. Mary's University community. We care about you, and we want your time with us to be safe, healthy, and productive. This is about personal responsibility, justice, and equal access to education.
We take this seriously, and we hope you do as well. Only by working together will we create and keep a violence-free campus. Thank you for completing this tutorial, and have a great semester.